Hi, I'm Dr. Chris Crowley at Skin and Tonic in Pensacola, Florida. We are doing an Ulthera treatment today here in our office, and so we'll cut to this and show you the actual procedure in just a couple of moments. But Ulthera is a high-frequency ultrasound machine. It's actually, you can get this through MERS, which is one of the Empire partners. So talk to one of your local guys if you want to find out a little bit more about this particular machine and how you can incorporate it into your office. We actually do quite a few of these treatments. It is a little bit uncomfortable, so you'll notice with this patient that we are using Pronox, which is a nitrous oxide or laughing gas, as most people know this, to help relieve a little bit of anxiety and help some with the analgesia for the patients to tolerate this procedure. The procedure involves using ultrasound energy at varying depths to tighten the skin and to create a lifting effect. So there are numerous heads that go on the device that have multiple ultrasound probes in them that will cross each other at a certain depth. And at the depth that those ultrasound waves cross, it creates a thermal coagulation point or a heat point, which will cause a little bit of tissue damage. And as that tissue heals, you're going to stimulate collagen and create lifting in that area. We can do these treatments in a number of areas of the face, the neck, the décolleté. The patient that you're going to see us doing this on today, we're doing a brow lift. This is a really effective treatment. It's something quite fun for the patients. They get to see a pretty quick result from this, and it's something that can be delegated in many states to other providers in your office. So as always, check with your healthcare attorney and your local state regulations to make sure that it can be delegated to the appropriate staff in your office. But many times people find this a profitable procedure for their office because they can actually have in our office, we have medical assistants that do this procedure, nurses that do this procedure, and you're going to see Jerry doing this procedure now, who is one of our nurse practitioners. So this is the Ultherapy machine, or Ulthera, and this is real-time ultrasound imaging that's transmitted from the probes. So the probes are of varying depths. We're using a 1.5 millimeter depth probe currently, and this line shows you the depth at actually which we're treating, and so we're able to look and actually see and make certain that we are treating at an appropriate depth to create the lift that we would like. So this is a brow lift, so it's actually pretty superficial in this area. However, as we get into other areas of the face or neck, we will treat at varying depths. As you can see in the cart, there are numerous size heads, and these will show you the different depths. For instance, this is a 3 millimeter depth transducer that we're seeing here. This transducer, we have a conductive gel, an ultrasound gel, that we apply on the patient's face, and then we use the transducer actually to scan and to see the appropriate depth of treatment, which is usually going to be, for the lower face, we're going to be targeting the SMAS layer. As we press and discharge the ultrasound, we will deliver energy between these 2 points at 3 millimeters depth for this particular probe. That creates thermal coagulation points, which will create a tissue injury and eventually the healing and collagen production, which is then going to result in lifting. Now we have different heads in here, so this is a 3 millimeter head, but as you look, we also have, this is a 4.5 millimeter, and the size of the head controls the depth as to where we're delivering our energy. And the way that we're going to determine the appropriate depth is actually scanning the patient. So we will scan them with real-time ultrasound, view our ultrasound imaging, and then we will use our device to deliver the energy. Now this is a 3 millimeter head. This is a narrow head, and so this is one that we can use for treatment of perioral lines, either above or below the lip. Also, we can use this for some areas occasionally if we need to deliver a narrow band of energy when we're working around the brows. As you'll see now, Jerry's working with a 1.5 millimeter head. This is our main transducer. This is with the different type of head that I just was able to demonstrate to you, that's going 1.5 millimeters deep. So our energy, the thermal coagulation points, are being delivered at a depth of 1.5 millimeters. So the device, we will use this. You'll see as he treats the patient with this is conductive gel that you see on the head here. And as he scans the patient and looks and makes sure that we're at the appropriate depth, before he uses this to discharge the energy. For the brows, in many patients, this is going to be our appropriate depth. Occasionally, we will have to use a little bit deeper head to get to the proper layer, but most of the 3 and 4.5 millimeter depths we're going to be using for lower face. Again, it depends on that individual patient that you're treating and what you're going to see when you scan the patient.